Good morning, everyone. I am happy to have you in this episode of our Health Talk. Last week, we had a discussion on diabetes, and today we'll be talking about another disease condition called hepatitis. Now, why should you listen to me? I am Tayo Oyekale by name. I'm the CEO of His Grace Medical Diagnostics, and I'm a certified and licensed medical laboratory scientist. And over a decade, I've been able to gather wealth of experience and knowledge from different hospitals, both government and private-based organizations. And with my experience, I've been able to diagnose different kinds of disease and infection, and part of which is hepatitis. And with my interaction with hepatitis patients, I discovered many of them contracted this infection because of two reasons. Number one, ignorance, because of lack of information. And number two, poor implementation of knowledge. Now, the reason why we are bringing all this health talk to you is for you to have the right knowledge and be able to implement the knowledge. So I will advise you to take your pen and your jotter and jot some vital things down and implement them after learning. So let's go straight to the point. What is hepatitis? Hepatitis is the inflammation of the liver, and hepatitis can be caused by different factors. I'll talk about by two things first. I'll talk about the infectious hepatitis. Now, infectious hepatitis is what is called viral hepatitis. It is caused by virus, and this is one of the causes of hepatitis. And apart from that, we have the non-infectious one. Now, the non-infectious one is caused by different factors. It can be caused by alcohol, taking too much of drugs. So it can be caused by drugs. It can be caused by medications, toxins. It can be caused by toxins. And also, we have the autoimmune hepatitis. Now, in this case, the immune system of your body destroys the liver cells by itself. Now, the liver cell is recognized as an antigen, so the body now destroys it. So, destruction of the liver of the body by the body itself is called autoimmune hepatitis. So, these are the causes of hepatitis. So, after that, let me quickly talk about the classifications of hepatitis. Hepatitis is classified into 5. We have the hepatitis A infection, now caused by hepatitis A virus. And this one is contracted through contaminated food and water. It can be contracted now maybe through uncooked vegetables or improperly cooked food or contaminated water. Now, this one can cause hepatitis A infection. Now, number 2, we have the hepatitis B infection. This one is caused by hepatitis B virus. And this one is contracted through body fluids, through blood, through vaginal secretions, through semen. So, and it's a very dangerous hepatitis, and most common among people having hepatitis. Then we have hepatitis C. Hepatitis C is caused by hepatitis C virus, and also a blood-borne infection. It is the same like hepatitis B. It is caused by body fluids, it is caused by transmitted through body fluids such as blood, vaginal secretions, and semen. And both hepatitis B and C, they are very dangerous because they can be asymptomatic, in the sense that the person having it may not show symptoms in the early stage. Are you getting me? So, and because it's not showing symptoms, after later, you can just say the person is having liver issue or liver infection or liver damage. So that's why it's very dangerous. Then we have the hepatitis D infection. This one is caused by hepatitis D virus. And this is a dependoviral infection. Now, it actually depends on hepatitis B infection. So that means people that is having hepatitis B infection are the only one that can have hepatitis D infection. Then we have the hepatitis E infection. Now, this is caused by water, contaminated water. So it is a waterborne infection, and it is common among rural environments where there is poor water system, where there is no proper sanitation or hygienic condition. Now, after discussing this classification, now let's quickly talk about the signs and symptoms of hepatitis. Number one, fatigue. The person can be having weakness in the body. The flu-like symptoms. The person can be having some flu-like influenza symptoms like runny nose, cough, fever, cold, and so forth like that. Apart from that, the person can be urinating dark urine. It's another signs and symptoms of hepatitis. Then the person can be excreting pale stool. The stool can be light. Then another thing is unexplainable weight loss, and also abdominal pain. This can be signs and symptoms. Serious and frequent abdominal pain. This can be signs and symptoms. Apart from that, then yellowing of skin, yellow discoloration of skin and eyes can be a signs and symptoms of hepatitis. And yellowing of skin, this can be a condition called jaundice. Because of the jaundice, this is a condition whereby the skin, the yellowing of the skin and eyes, and this can be caused as a result of hepatitis. Now, what are the diagnoses of hepatitis? Number one, physical examination. The doctor can examine the patient or the person suffering from hepatitis by pressing the abdomen to see if there is any pain and tenderness. If there is a serious pain and tenderness in the abdomen, it may be a sign or diagnosis of hepatitis. Apart from that, we have the laboratory examination, whereby the blood of the person will be collected. And number one, it can be examined for liver function test. Now, liver function test, in the sense that there are some liver enzymes. There are some enzymes in the liver tissues. Now, if these enzymes, the value, if they are higher than the normal range, this can be a sign that the person is having hepatitis. So, and its blood is being collected to estimate the liver enzymes. Apart from liver function test, we have checking the antibodies. Now, if someone is having liver infection as a result of hepatitis, there will be an antigen of it in the liver cells. And when there is an antigen, there will be production of corresponding antibodies. There will be production of antibodies that will be fighting against the infection, the antigen. And since there is antibodies in the blood, if these antibodies is being estimated in the blood, this is a diagnosis that the person is having hepatitis. Then apart from that, another thing that can be done is ultrasound scan. Now, ultrasound scans can be done to check if there's a liver inflammation. Now, liver inflammation says that there's a liver enlargement, or if there is liver cirrhosis. Now, liver cirrhosis is the thickening and scarring of the liver cells. And so those people that take alcohol or if it is through viral hepatitis, the liver can become thickened and scarring. So it will not look normal again. This is what ultrasound scan will show when somebody is having a serious hepatitis condition. Apart from that, liver tumor can be examined. Then the gallbladder will be showing abnormalities through the scan. So these are the signs and these are the diagnoses of hepatitis. Apart from ultrasound scan, liver biopsy can be done, whereby the liver tissue will be collected, be taken to the laboratory, and to be examined for any liver cancer or malignancy. After this diagnosis, then what are the complications of this hepatitis? Now, someone that is having hepatitis that is not diagnosed or treated can have complications. And the complication that can occur is that the person can have liver damage, complete liver damage, complete liver failure. Now, the person can be having kidney problem. It can also affect the kidney because of this hepatitis. Apart from that, the person can be having serious, even if the person eats like this, the food will not digest. Undigestion of food, the food will not digest. This is a serious condition, and it can even lead to the death of the person. These are the complications of hepatitis, and that's why it's very important you diagnose yourself to know if you are having hepatitis or not. Now, how can you treat hepatitis? You can treat hepatitis by taking antiviral medications. There are some antiviral medications that can treat hepatitis. Then, if it is through contaminated food and water as a result of hepatitis A infection, now oral hydration can be taken. Or the person can obtain bed rest to normalize the body. So this is how to treat or manage hepatitis. Now, how do you know that you are having hepatitis? Is by running laboratory investigation. And its Grace Medical Diagnostics is readily available for you to help you to know your health status pertaining to hepatitis. We are right there at Araro, beside petrol station. So you can contact us on 090 26 93 55 69 or 081 04 02 63 13. It's very essential you diagnose yourself to know your state. But I always advise people to run hepatitis tests once or twice in a year. I run it twice in a year just to know my state. It's very, very essential to take care of your health, because your health is your life. And we are much concerned about your health. Now, we want to implore you to help us share this video to your loved ones, to your friends, and also subscribe to our channel. We are in a mission of enlightening people about their health and their status. Help us to share this video, and God bless you. Thank you for watching this video. God bless you.